This chapter will cover the Recruitment Maneuver app of the Gentle Lung Suite. It is only available with NKV 550 and NKV 440 ventilators.
This video is not a substitute for training on the ventilator and assumes the clinician has read and understands the operator's manual.
As part of the optional Gentle Lung Suite of Nihon Kohden's ventilator system, the Recruitment Maneuver app is a tool that clinicians can use to recruit a patient's lungs. Refer to the instructional video of the Recruitability Assessment app to obtain RA results before starting the Recruitment Maneuver app. The RM app may be used on patients who are on ACMV or SIMV modes of invasive ventilation and weighing 25 kilograms or more. The maneuver is not available while in SPONT mode. RM is only executable after 60 seconds from the completion of a recruitment maneuver. To begin, locate the Recruitment Maneuver app in the Apps panel. Tap on the RM app to open the application. When patient data is available, a window displays warnings prompting the clinicians to review prior to starting RM. Tap the arrow at the bottom right corner of the display window to continue. The Recruitment Maneuver app may be used in invasive therapy using ACMV pressure control mode. The clinician may continue with default settings or change settings at the setup screen of the Recruitment Maneuver app. Tap on each required control setting to change the value. Use the rotary function of the encoder knob to deviate from the default setting and press the encoder knob to confirm the change. Enter delta PC, IE ratio, respiratory rate, and FiO2. For max pressure allowed, this setting must be below the high pressure alarm setting, otherwise, the start button will not be active. Enter the increment of each PEEP step, the duration of each PEEP step, and PEEP after the end of the procedure. A graph is visible to allow the clinician to preview the maneuver. The horizontal red line at the top of the graph indicates where the high pressure limit is set. Once done, tap on the Start button to begin the RM. The ventilator will begin the RM based on the clinician's setting. A new window will display a time progress bar that shows the total time and elapsed time of the recruitment maneuver. The Hold button at the upper left corner of the window allows the clinician to extend the time for the current PEEP step. Press Resume to continue with the RM as programmed. The clinician may end the maneuver at any time by tapping the End button to cancel the RM and no results will appear. The top window displays a PEEP time-based graph to show the progress of RM. The second time-based graph below is defaulted to show estimated compliance. This graph can be changed to show another parameter if desired. Refer to the operator's manual to change the second time-based graph to other than the default display. When the recruitment maneuver is complete, the ventilator will resume normal ventilation but will maintain PEEP according to the PEEP after end of procedure setting. A vertical cursor appears on both graphs along with the measured values for the current cursor position. Clinicians can move the cursor using the encoder knob to view measured results throughout the RM. A 5-minute timer appears at the end of RM to allow the clinician to end the maneuver or proceed to PEEP titration. Press the Go to PEEP titration button to proceed. When selecting to end RM, PEEP is returned to pre-recruitment maneuver settings.
This concludes the overview of the Recruitment Maneuver app. Thank you for watching.